is one of our co-chairs, and then Susan Potter, who's the president of Mercer, which is a big benefits and health consulting firm here in the US. I won't go through all these folks, but we have public health leaders, sustainability, and corporate leaders all realizing this is a cross-sector initiative to really build this kind of framework. So what I'm here to do today, and I'm about to wrap up in a second, it's just very quick opening remarks, is share that this commission is just one of the many initiatives out there working to make health central to climate adaptation. If you want to get that QR code, I would love that, of course. But what's most important is that we have a number of organizations here today thinking about approaching health from media, from the healthcare system, and from lots of different angles. And so I'll be around if folks want to chat about the commission and our work or get a bigger version of the QR code. I'm happy to get that out. But I want to now hand it over to Yit Kay Lung to talk about Healthy Planet Now. Thank you.
Thank you, David. Extreme heat, air pollution, flooding, and wildfires. The climate crisis is impacting communities worldwide and straining health systems. And Healthy Planet Now invites global, Healthy Planet Now is a global invitation inviting people to share the climate and health stories around the world, and also to call on leaders to put health at the heart of climate action. So inspired by Healthy Planet Now, this event aims to be anchored by the Bellum Health Action Plan and really bridge climate and health together and look forward to the next steps towards the road of COP30. Everyone has a story to tell, whether you are directly impacted by the climate crisis or you are concerned for the health and well-being of your communities and families. Everyone has a story to tell, and Healthy Planet Now invites you to tell your story as well. So I'd like to show you a brief trailer of Healthy Planet Now to help frame the discussion, and then we'll pass it on to opening remarks. Thank you.
Even small number of people can have an impact.
Welcome to Del Carmen. This is my home.
Morning, around 7:15.
Freetown's changed so much since I was a child.
To sit there and watch areas be incinerated, they'd never recover to what they were before.
More than 35 Celsius degree every day.
People are suffering from flooding, disasters, landslides, mudslides.
She's inhaling the toxins. I'm inhaling the toxins.
People are hungry. They lost their jobs. There's no water. How do you feed everyone?
When I become anxious, I just remind myself that I can simply come here.
I think what's most important is trying to change the society. That is where the impact on the climate is the biggest.
The efforts to restore nature save lives.
It's the citizens that have the real power.
We've seen an amazing shift in our country's sense of what's important. Rewilding, regenerating, it's an amazingly healthy thing to do.
You know how sometimes when people are afraid of doing something, they just need someone to start first.
What I do here, it affects everywhere. The world. We need the world to create a better world.
We're not alone in this. We've really got to act in a way that's different.
I'd rather live now when the change is possible.
I would like now to invite Marcela Oliveira to the stage for opening remarks.
Hello. Hello, good afternoon, and beautiful video, right? It's beautiful to see the climate action, the healthy, and art and culture together sending messages. For me, this is really important. So one more round of claps for the video and to this initiative. I am Marcela Oliveira. I am Presidency of Climate Champion for COP30, but also I am climate activist, and I believe that's the reason I'm here. Because in my neighborhood, one place called Realengo, at Rio de Janeiro, in Brazil, we fight for one green park too many years, and in all these years, the leadership of the city said to us, this is not necessary. They say to us the development is more buildings or more parking or anything not useful for the community in Realengo. So this fight showed to me the opportunity to understand we have one really important technology, and this technology is called trees, forests. And these forests, these trees have to be protected. So if these forests have the health protected, our health are protected too. And now we have one green park in Realengo because of the fight of the community, because the community press, the community communicates, because the community understand the opportunity to one economic development with this green park. And now we don't have just one green park, but one public policy in the Rio de Janeiro city about green parks in the periphery. So this story is really beautiful to share because it's not one story. Is one history around the world with many histories about the youth, the communities, the Black women, the indigenous communities, the people with disabilities. We are doing the climate action at the local level, and this is really connected with health, because when our health is with us, is okay, is protected, our opportunity to look around is much bigger. And when the health is protected, the people be more open to be activists. I don't know if you think about this before, but when we are sick, the first thing we do is burn out. We have to stop to do everything. So if we want to save the planet, we need to take care of our health. And not just our health like persons, but our health like part of the planet. So the health of the planet, the health of our systems, the health of our education, the health of our UN. This health, not just stand up in the morning, but health like taking a time to a break, to stay with our families, to take care of our friends, or go for one beach or one green park. This type of health to live a good life and not just survive, is the health we want to protect too. Because we want to be activists, we want to make difference, we want one COP for implementation, but if I am sick, I can't do this type of speech. So I'm here with my friends and also my team, Mateus and Beatriz. We are here at this week to see our president, of course, and all the leaders at UN trying, because this multilateralism is really important, and we understand they are trying. But also we want to talk with the other children youth movements, because we understand together we can maybe send a strong message for them about the importance to act now and not just make discourse in one big room. So we have 3 things this week here. The first is one NDC campaign, because the NDCs is one compromise of the parties to be delivered, and if the COP30 come to us with this first compromise, don't advancing, it's impossible make good agreements there. So like we understand in the art and culture in Brazil, we make buttons to put in everyone in the UN tomorrow with NDC now, like a campaign, just to send a message. So this is the first thing we've come to do. The second thing was to talk about the Children Youth Pavilion at COP. One important pavilion to this type of conversation happened with the youth lead. And this pavilion, can you believe that? This pavilion is not guaranteed yet. Yes. So our responsible also is share. We have a big opportunity at COP30 inside and outside the venue, because in Brazil we are a democracy, so a lot of houses, a lot of camps, a lot of things are happening in the city, and it's inside the Amazonia, so it's impossible to go to Amazonia and coming back the same person, impossible. You will see, yes. But the Children and Youth Pavilion have to be shared with more persons, so if you are listening, please, if you have one idea of person we want to invite to know this opportunity with Children and Youth Pavilion, we are doing this all this week, sharing this challenge and saying for the partners, this pavilion maybe is the most important pavilion at COP. And I am Brazilian, so have one pavilion in Brazil, but Children Youth Pavilion. And also, I understand another thematic pavilions will be there, and this pavilion is important to make the conversation happen. And this led us for the third thing we are doing this week. Our responsibility is talk with the people. This COP is not just one more COP. Have to be one COP for implementation and have to be one COP for climate education. Because if we can commit more person about climate justice, about the importance to press the governments, about the things are in our days like healthy, like the food we eat, like the quality of the air, like the problems with the floods, with the hot waves, but of the solutions. Solutions based in the nature, in the culture, in the bioeconomy. So if we can make climate justice be an agreement and not just a concept, and with the heart and the hands in the South Global, maybe next year, this conference, this New York Climate Week can be different. Because we have a lot of person trying, but this person don't have the opportunity to be here. So we, the person here, have also the responsibility to defend the person making the climate action in the local level, and that's the responsibility we have in the PICC team for COP30. So I was invited to be here for these open remarks and to share the challenges, but also the perspectives we have. And I want to finalize saying for you, the healthy also is with our climate memory. So if you close your eyes 1 minute with me, please. It's too close, I'm seeing you. If you close your eyes and remember when you walk for your school, university, you remember your street, the community when you're born, have probably one thing there you always remember. Can be a tree, can be a river, can be a park, can be a bus, I don't know. But when we close our eyes, we remember the environment because it's our house, it's our community, our territory. So talk about healthy is talk about the thing we want to protect when we close our eyes. Understand? Yes? So this compromise is really important, and I know you are here because you agree with that. So thank you so much to invite me, and one beautiful conference and conversation for you. My name is Marcelo Oliveira, COP30 Youth Climate Champion, so count with me to close the eyes and sometimes make exercise, because I do this a lot inside the UN conference. I say, stand up, exercise, and the leaders was crazy with me, but this is important because it's about healthy, and it's about understand broke the rules is also part of our youth energy, because it's not impossible to save the planet without energy, and energy is also health. So everything connected. Thank you.
Thank you, Marcella. Next, I'd like to welcome up Madeline Thompson, Head of Climate Impacts at Welcome.
Thank you. No better explanation of why health is important in the context of climate. Thank you. That was just brilliant. So my name's Madeleine. I head the Climate Impacts and Adaptation work at the Wellcome Trust. For those of you who don't know the Trust, it's a large foundation based in the UK. We fund basic and applied science for health specifically. And we have 3 areas that we work under for solution science, and that is mental health, infectious disease, and climate and health. And we've been working on this for a number of years now. And when I was asked to make some opening remarks, particularly thinking about the road to COP, Welcome's first COP was the COP26 in the UK. It was a fantastic opportunity for Welcome to put its marker in the sand and say we are here for climate and health. We think that health is central to the climate discussion. We think that it's not only important to use health arguments to drive mitigation, but also we need to protect the population's health in adaptation. And we do see these things as very linked activities. There's no real adaptation in the long run without mitigation, but we've seen the climate has started to change pretty fast already, and we need to make sure that the most vulnerable populations have the best protections that are available. So in the thinking of the work that we're doing at Welcome, I'm just actually going to jump up onto here. Up. I'm always a bit scared of falling off platforms. And that is, when we think about adaptation, and I think, okay, I head the adaptation program at Welcome. We must know something. And there's a lot of stuff we really don't know. And the big challenge is how do we actually know that the levers that we're using, the policy levers to drive adaptation, are actually working? How do we know that our adaptation strategies are actually being implemented and effective on the ground? And I always think that this is a much harder issue for adaptation than it is for mitigation. My mitigation colleagues argue the otherwise, but I think it's true. Adaptation is not an end game. We are never adapted. We adapt as time goes by. So you really have to think about adaptation on a temporal timescale. Adaptation for the moment, adaptation for the next 10, 20 years, adaptation for the long term. We have to have a timescale that we're adapting to, and we have to know that the adaptation solutions that we put in place have the flexibility to respond to whatever the climate brings us going forward. So that makes it a much more difficult task, if you like, to think what are the benchmarks, what are the baselines that we're going to use to know that we've adapted to the climate. And one of the things that I've been very persistent on is that you can't adapt to climate if you don't actually know anything about the climate. So we have to understand the climate in context. We have to understand what the climate is doing in the place, amongst the people, in the context of the adaptation strategies that we're engaging with. And that's why the health community has been slow, to be honest, to really engage with the climate community and get their knowledge and understanding about what's happening with the climate. Is the drought return cycle getting faster? Yeah? Are the risks from sea level rise the same all around the world? Absolutely not. They're much more significant in some parts of the world than they are in others. So not what we talk about as global measures are very important for driving policy, but they're not good for driving adaptation at the local level. We have to understand the local context. So the way we've kind of approached this at Welcome, and the impacts and adaptation is joined at the hip, if you like. You have to understand the problem. How is climate impacting on something? Whether is it the heat impacting on what we're working on, maternal and child health, or on mental health, or on infectious disease, or nutrition, etc. What are the actual mechanisms driving that relationship? If we can understand those mechanisms, not only can we think about the right interventions, but we can start creating adaptation solutions for the long term against really clear benchmarks and what have you. So we have a program of work which is very much about funding research. We're a research funder, but our research funding is only legitimate, I would say, if it actually changes things on the ground and drives innovation and new interventions. And the 4 areas that we're exploring at the moment that we would want to do this with, which I think is particularly relevant to the adaptation community, is how does it drive policy? How does our research change policy to protect vulnerable populations? How does it change financial flows towards those who need the resources most? How does it inform legal action? One of the things that we've observed is we fund health research, and a lot of it is around the mechanisms. What is the relationship between heat and mental health? Could be the fact that drugs don't work so well when people sweat. they sweat out the drugs. So people who are dependent on drugs for support to their mental health, that may not work so well. That's just a small example. So understanding the mechanistic pathways means that that information is actually helpful in a legal context, because legal contexts require a mechanistic understanding of what is happening. And then fourth is, of course, innovation. We need to innovate. We need to understand what new opportunities there are to protect populations going forward. So understanding the impacts, thinking about the interventions that could emerge, testing those interventions, and making them suitable for implementation. So philanthropic organizations, they might sound wealthy when, to start with, but in the big scheme of things, they can provide catalytic funding. They can provide new ideas. And in the previous section, which I thought those of you who attended, it was a very good session, they really talked about, how do you manage climate risk? Where's the finances for adaptation in the private sector? That's a really important part of it. But private sector often doesn't come in because the innovation risks are too high. So philanthropy can help there. Explore new ideas, test them out in context, etc. And then either government or private sector partners or NGOs, etc., can take on responsibility for the work going forward. So we then need to think about, well, A, what's the evidence that new interventions are actually working? And we fund something called the What Works Conference for climate solutions. And I think that's really important, because the challenge around climate change is that much of the evidence, if you like, is long-term. So you can have somebody say, this is a great solution, it works over the next 2 years, but we don't know if it works over the next 10 years, yeah? And how reliable that is. So we need to build evaluation into the programs that we do, and we need to constantly revise that and make sure that that information is available to policymakers, etc., and others who are interested. So building an evaluation strategy for adaptation, again, just like an impacts program, requires this multi-timescale approach and understanding how the climate is actually impacting locally. And that is where this whole issue about climate services, which you might hear increasingly about, climate services for health, it means an understanding of the climate that is relevant to the health community, to allow them to not only develop early warning systems, but actually measure the impacts of what they're doing. Because if you're impactful against a climate that is going in the wrong direction for you, then you know your adaptation strategy is working. If you're impactful and the climate, I've got great examples of this, basically. Malaria declines when you have a drought. So people can say, oh, our interventions were fabulous, malaria has declined. And you go, yes, it has declined, but there were 3 major droughts during this period. Have you factored that in? So if you don't bring in the climate component, you can't do the evaluation piece possibly properly. So I just want to talk a little bit about the COP process. We have a welcome. I work on the research team. We have a big policy team that's been very much engaged in COP and ensuring that, along with many other partners, health is now represented at COP in a very dynamic way. And we'll see that at the Belém COP, that health is now very much at the heart of climate action. That's our mission statement from Welcome, is putting health at the heart of climate action. And in doing so, we have to make sure that whatever is proposed makes sense in terms of adaptation strategies and the building of indicators of success. And we think about some of the big ones that are looking, climate early warning systems for all, big UN effort that has to work for health. It has to deliver for health. If we look at the heat adaptation plans and the heat action plans, that actually has to deliver for health. We need to get the baselines and the benchmarks in so that we can create proper indicators of success that not only work at the global level, but actually work in this multi-level process from the community level, but also in time. And I think the time piece is often forgotten. So I would like to end there. I'm very open to hearing your thoughts and ideas and the next panelists about how we should think more about benchmarking and indicating, because it's a challenge. Nobody has solved it yet, and I can't solve it in 5 minutes. But we can solve it together if we have a stronger collective view of what is needed. Thank you.
Thank you so much, Madeline. That was fantastic, and Welcome is doing so much amazing work in this space. So thanks everyone for being here. How's your Climate Week going so far? I know everyone has been traveling a lot and running from event to event, so we have a really exciting panel lineup here today for you all, and I'm excited to introduce our panelists. If you can all just sort of come up and sit on stage now. So here we have Isra Chakr, who's the CEO of Every Pregnancy, to my right and white, and we've got Josh Carliner to my right over here. He is the Director of Global Partnerships for Healthcare Without Harm. He's also Healthcare Without... Goodness, I'm so sorry. Josh is also representing indirectly the National Commission on Climate and Workforce Health, which we talked about earlier in the session. We've also got Kara Cook here on the end. She is the Global Climate and Health Alliance Board representative here. She's also the Deputy Director for the Alliance of Nurses for Healthy Environments, and we're going to hear from her a little bit more about how nurses can kind of help and step up to the plate in some of the challenges that we'll face ahead. We also have Natalia Lanou here in between Isra and Kara, and she is the Deputy Director for the UN Development Program's Health Team. So thank you all so much for being here. Yes. Okay, great. Well, thank you guys all for being here today. Just make sure your mic is on before you start speaking. I wanted to ask you about the video that we saw earlier. I'm sure for everyone it kind of struck a chord. We've all been thinking a lot about how these affect our personal and our professional lives as time goes on. I wanted to see if any of you had thoughts on sort of the video or how it resonated with the work you're doing or even your sort of personal experiences with climate change.
Start us off. Hi, everyone. Thank you for being here today, and thank you for having Every Pregnancy here at this event. We are an organization that is a partner-driven coalition with over 50 organizations that work on maternal, newborn, and child health projects globally, where we are saving moms and babies on the front lines of crisis and in the hardest to reach areas. And what I was thinking while watching that trailer was, I was happy to see babies, naturally, in the trailer because it really connected, even visually, the idea of health at the beginning of life to climate. When we talk about climate change is a future health threat, I would argue that it's not a future one, it is a present one that is the most clear actually in pregnancy. Whether you're talking about an earthquake in Morocco affecting access to maternal health clinics, or the floods in Pakistan washing away health infrastructure and not allowing moms to have to deliver in unsafe conditions, or the effects of the chemical weapons used inside Syria for decades, or the genocide in Gaza completely being obliterating any health system and creating impacts on the food and nutritional access. All of that is related to climate change, and all of that is most affecting moms and babies. And we've seen this, the data shows it specifically, that moms and children are the most vulnerable in these situations and have the greatest impact and the greatest loss. So they have a higher mortality rate because of climate change drivers. So that was one of the reflections I wanted to share. I wanted to create some space for my panelists as well. But we know that in particular that moms need access to healthcare, and they need access to maternal health, whether it be maternal health units or medications or equipment. And weather should not be a defining factor, whether or not a mom should die or survive, depending on where she is and what natural disaster or climate change intervention she's actually experiencing.
I can jump in with just some very quick reflections. So as I mentioned, I'm Natalia Lanou at UNDP. I'm originally from Greece, and I'm a social epidemiologist. So I look at big numbers, and I think what's really useful with the film is telling just the stories, right? Those of us in public health often look at these figures, we look at associations, we talk about risks, and that's difficult to convey the message. And as someone who spends every summer in Greece, I have seen summer after summer the change in my lifetime. I have seen being worried about, this summer, for example, I was there and heat closed down, the public sector said everybody cannot work this summer because the heat was too high. They shut down tourist venues, things like that. I have 3 children. I was worried in the nights when there was a breeze. It was like beautiful. And it was like, oh my God, if a fire sparks right now, we will have to evacuate. And that, living in fear and the mental health impacts, I think those stories are real. And for a country like Greece that has the potential to be solar panel, to be, it's also a feeling of a missed opportunity. So, I think the stories really do capture. And so I'm delighted that, we're using the arts to convey what those of us in kind of the health space know in terms of numbers, because I think that does capture the imagination of folks.
Yeah, and I'll just jump in here. So at the Alliance of Nurses for Healthy Environments, we work with nurses globally to get more involved in climate action and environmental health. And as I was reflecting on the trailer, I was at a session this morning on narrative change, and one of the panelists mentioned, the climate movement lacks that cultural and political will, that power. We don't lack solutions, we lack that. And that, to me, comes from narrative change and storytelling. And that's one of the things that we're trying to focus on, specifically with nurses, is how do we showcase nursing stories, not only the climate impacts, but the climate solutions, and amplify that on a global scale. Because I think what the trailer so greatly emphasizes is that global impact doesn't just happen at COP. It doesn't happen in policy spaces, although those are very key pieces. It happens with the actions that people take in their everyday lives. And so we're trying to get nurses to recognize how does your work in your hospital or your clinic, how is that contributing to that global impact, and using that kind of storytelling to help lead into that narrative change that we need.
Yeah, I'm curious, sort of speaking of that, like how are you all thinking about, we're seeing in our lifetimes these disasters playing out, this extreme heat, all of these different things that affect our health. Like, how are health systems responding? Like, are they responding, first of all? And then, can you talk a little bit about some of the specific ways, health systems are responding or could be responding?
So I'll jump in on that one. So I've been working on climate and health for almost 2 decades now. And when I first started, Madeline was one of the only other people working on it. There were very few of us. We were voices in the wilderness. And that's changed tremendously. There's a growing global health movement on climate. And one of the reasons that movement is growing is because the impacts are so severe. And we're seeing those impacts everywhere. I mean, we just heard 3 different examples, and we could spend the whole panel talking about those problems. But we're seeing a growing global response as well, and that's really heartening. There is a movement on climate and health. And that comes from the grassroots. It comes from nurses organizing and doctors organizing and public health workers organizing on the ground in their facilities. The 500 facilities that were flooded in Brazil last year, in southern Brazil, is one example of many where our health systems are being impacted, and then the response is to try to actually build that adaptation, build that resilience, and also move toward a low-carbon model of healthcare itself. Because one of the things that we've found is that in addition to being on the front lines of the climate crisis, the health sector contributes to 5% of net global emissions. And so it's our responsibility not only to adapt, to care for our patients, to care for the communities, but also to begin to build a climate resilient health system that also is low carbon or even moving toward net zero.
What about like in a hospital or in a healthcare setting, like a maternity ward? Like when you have a heat wave or a flood or things like that, are there ways that health systems can kind of respond more effectively to that, or even preventatively, looking for things like strokes after wildfires or things like that? I'm curious about Isra and Kara's perspectives on this.
Thanks, Emma. I was just in Pakistan about a month ago, seeing firsthand programming of our partners implemented in different maternal health clinics and hospitals. And I got to actually see and witness firsthand even the inequality in a place like Pakistan between a hospital that is privatized and run through private companies and a hospital that's run by government, as well as maternal health clinics in different villages. And I was shocked and astounded at some of the things that I witnessed firsthand. First and foremost, the conditions there, weather-wise, are tremendously challenging. It was around 100 degrees every single day that I was there. There are no AC or air conditions in the majority of these clinics. There are no fans in the majority of these clinics. And there's overcrowding. So in one clinic, I think we saw 200 women in the waiting room, waiting to be seen for one day. And there's no appointment system, as you all know, in some of these places. So they're there, they go in every day, they wait for 9 hours, hoping to see a doctor and have an antenatal care visit. And if they don't get a chance to see a doctor, they'll come back the next day and try that again. And so what I quickly realized was, one, it was tremendously hot. And I was asking and wondering around, okay, what can they do to provide some of support for even the heat in these facilities for these moms that are laboring? A lot of them are actually laboring or delivering without any air condition, any access to fresh ventilation. The second is we saw a lot of insects and rodents and animals even in some of these clinics. So stray cats, stray dogs running around in a delivery unit in a hospital. And it's not because they don't care to provide the best quality care for these moms and babies. It's because they don't have access to the resources and they don't have access to the proper infrastructure if it's not privatized. And that's really where I think that financing is really important in this conversation. We can't talk about health and we can't talk about climate without talking about who's funding it and how much of the adaptation funding actually reaches moms and babies in particular where they need it the most. So what I did see as part of the narrative for all this, so I want to make clear here, is I did see a lot of doctors and midwives take it upon themselves to bring fans to their own patients. So they would bring a fan for a mom who's delivering and have someone hold there and fan her as she's delivering. And that was a small way of showing up for her, but it made the biggest difference to her in that process. I saw other doctors who took it upon themselves to try to do more of the sanitation and the hygiene in the facility and try to advocate for solarizing and putting solar panels on some of these clinics. So there's been a lot of advancement, and we know that some of the clinics that had the air condition, they had backup generators that were personally funded from other companies or organizations that they were able to cultivate and maximize on. But ultimately, what it showed me is there's a breakdown in the funding. And when you are able to address the funding gaps, you can then better the solutions. But no one knows the solutions to these issues better than the people that are in these contexts that are operationally living in them day to day. I'm a very big fan and probably a big champion against the idea of parachuting in as an NGO, coming into these communities, putting Band-Aid solutions, and then stepping out, right? If you're gonna come in and fund, for example, AC units or solar panels on a hospital or a clinic, then make sure that you're actually making sure that they're fully operational, that they can be sustained for years on end, that you're continuing with the maintenance and the upkeep, but also you're investing it into a local company or a local organization on the ground to lead that effort. Local actors know what's best for the context in which they're operating, and we need to be investing in them and having solutions be led by them. I oftentimes held my tongue, even in Pakistan, in terms of I didn't want to ask a question that was assuming that me with my privileged perspective as an American living in the utmost privilege here, that I knew and I understood why they didn't have fans operating in these rooms. So oftentimes I would ask, what is the current situation? How do you think that people could get fans in here? And it was always framed from a question, but not a privileged perspective of I should tell you how you should be operating or that you should have fans in here. And I saw that that made the biggest difference to these local actors. So when I was able to learn, understand the context, and address the gaps, I think that's what gives us the position in our work to be able to address them and work together in finding the solutions, but really having it led by local actors, and we are just supporting them with the funding that's absolutely needed.
And as a public health nurse, I would be remiss to not mention the prevention side of things, because there is, a lot the health systems can do from adaptation and resilience building, but a lot of the care takes place in community. And that's where we can have some pretty big impact preventing those admissions and ER visits. And so one of the things that we've been doing at the Alliance of Nurses for Healthy Environments is training nurses to do just what you were saying, is how do you work with communities, particularly communities that have been historically marginalized and are disproportionately impacted by climate change? What is the role that nurses and health professionals play? Because we do, we do have that power and privilege that comes with working within a health system. We have access to different spaces that community unfortunately doesn't have. And so how can nurses be conduits for helping to uplift the solutions that are within communities? And so what we do with the nurses, we have an environmental health nurse fellowship program, which is training nurses within the US to work with their local communities and really bring their unique skills as nurses, but to take the lead from the community to really uplift those solutions and help kind of bridge the gap between health systems care and the care that the community needs, and to help build power within the community to get that climate resilience within the community itself, in addition to the health system.
Yeah, wow, that's really important. I'm curious, like, Josh mentioned earlier, like kind of the amount of energy and kind of action that's been happening in this space, and we heard about it from Madeline earlier, the amount of kind of resources going into research to characterize sort of what we're up against, and also to implement sort of preventative measures like what Kara was just talking about. I'm curious, Josh, if you could speak a little bit more about like how do you see the field, like where is the field today, and could you talk a little bit about the how these changes have taken place, and maybe are there still things you'd like to see change?
Sure. So, we're here in New York this week around UNGA and Climate Week, and it's sort of the, a stop on the road to Belém and COP30. And the Brazilian government has done a tremendous amount around climate change and health. The Ministry of Health has been leading a process to develop something called the Belém Action Plan on Health Adaptation. And that plan is sort of a roadmap for the health sector to really build a series of adaptation measures in a number of different key areas, and something that Wellcome Trust and several of us have been involved in advising and providing input into. But that, and they're also bringing it into what's called the action agenda and making resilient health systems a priority. But that rests on the shoulders of work that's been done over many years, especially the last 5 years. So COP26 in Glasgow in the UK created the COP26 Health Program, where 52 national governments committed to low carbon, climate adaptive health systems. That became the Alliance for Transformative Action on Climate and Health that UNDP is part of, Health Without Harm is part of, several other organizations are part of, and 94 national health ministries are part of. At COP27, the Sharm el-Sheikh adaptation agenda focused in part on climate resilient health systems. In COP28 in Dubai, the 125 national governments put out a statement on climate change and health, and then 48 million health professionals advocated for just transition away from fossil fuels as a key element for protecting public health from the climate crisis. And that helped contribute to the global stocktake decision for a phase out of fossil fuels, which is part of the COP negotiations. Last year, we saw Brazil's leadership in the G20. We saw the World Health Assembly resolution. So there's a tremendous amount of momentum that's gotten us to Belém. And so what's going on now with this adaptation plan is a chapter in a larger book. And that book needs to continue to unfold in the future to build greater health action on climate and climate action on health.
We're talking about being prepared, right? We're talking about coming up with initiatives to, bring health to the forefront in these climate negotiations. How prepared are we for what's to come? We heard Madeline talk earlier about, needing to understand what does that even mean, being prepared, what is, the future going to bring, how will it affect our health? I thought maybe Kara might have some thoughts on sort of what preparedness means and what we need to be prepared for.
Yeah, I think we're seeing action, positive action. I think it's not at the pace and scale that's needed. I think specifically when I'm thinking about healthcare workforce preparation, there's still a far way to go to ensure that nurses and other health professionals are prepared to be able to care for an influx of people who are impacted by climate-related events. And that has a lot to do with how nurses and other health professionals are trained. Nurses don't get climate change it's not across the board. Let's just say that. Some do, but for the most part, nurses don't get training in climate change and how that's impacting health and what they can do within their practice settings. And so that's a huge gap. And we're also not seeing climate change as a mainstream issue that the health sector views that they need to address, and not really connecting it to the major health issues that we're facing, like healthcare access, staffing shortages, how it's impacting chronic disease. And so we need to start thinking about how we can address these issues in tandem and be using multi-pronged approaches so that we can have the preparation among the healthcare workforce that we need. And the last piece I'll mention is that there is a huge gap in terms of climate finance for adaptation. The deal that was negotiated in Baku is really hopefully inadequate to address the climate crisis, and it's significantly short of what civil society was calling for. And I think that's going to be, a thing that is top of mind at this COP.
How about you, Natalia? Does this resonate for you? How's your sort of experience speak to this?
I mean, so UNDP is the biggest provider of UN sort of support to countries on their climate goals. So I come from the health team, but we have a very strong climate team that basically supports countries with their NDCs, with their NAPs, basically setting up on the policy front. As the development agency of the UN, we're also supposed to integrate across climate, across health, across energy. And I think there's been real innovation, but I think the financing piece is the one that is coming to mind. It's like, are we adequately financing the plans that we set? Are we adequately paying attention and doing what we need to do? So that's been kind of a top of mind priority. I think the global health community, and building on what Josh said, has been very successful in a few areas. I think air pollution has come to the top of many political conversations and sort of saying fossil fuels are the drivers of both. Heat is also becoming top of mind, especially because of the labor force implications. And I think we in the health community need to delve into the ones that are politically salient. So I think there is a lot of momentum happening. And for us, we've actually been very lucky in sort of the innovation space. The Global Fund, we are PR for the Global Fund, the UNDP. So we have supported the Global Fund to make sure that HIV drugs make it, things like that. And in Zimbabwe, about more than 10 years ago, we noticed that there was an energy access issue across kind of the more rural communities that was leading to vaccines and other sort of drugs not being able to be kept at temperatures. So we went back to the Global Fund and said, can we solarize Zimbabwe? And now we've solarized like 1,700 facilities across Zimbabwe. About 35% of Zimbabwe's renewable energy comes from the Solar for Health initiatives. And it is an investment that has been long-standing and improving. In Yemen, we're doing similar work, training sort of women technicians. So I think what's important is to not see this agenda lying only in the Ministry of Health. It really has to be ministers of health, ministers of finance, ministers of planning, coming together and saying, we actually have to solve for it, and a resilient health system is a resilient economy. It's a resilient future for our countries. I think there has been a transformation, and public pressure, the advocacy on air pollution worked in China, it worked in other places. So I feel that we are at the right moment, but we're also at a really tricky moment because global financing across the board is dropping. So it's kind of this tension of how do we keep momentum when we're seeing, if HIV funding drops, then a Ministry of Health that hasn't cared about climate maybe will delay on that because they say, wait, I need to get my antiretrovirals, and that's my top priority right now. So also we need to be careful not to create tensions and see how we can find some win-wins.
Yeah, and we will talk a little bit more about that in a second. We're not having this conversation in a vacuum, but wondering about vulnerabilities in existing systems. I know Isra talked about that a little bit, but it seems like something, when you talk about financing, like who gets left behind here, how do we ensure there is a just transition? Like, can you kind of speak to sort of, where are these vulnerabilities, and are there ways of sort of kind of starting to bridge the gap there?
Well, the majority of vulnerabilities are in low and middle income countries, typically. And in the industrialized countries, actually maternal mortality is the highest in the United States compared to other industrialized countries. And people oftentimes find that surprising, but I don't, because we know that inequalities are really due to, in the US particularly, around racism and around access to care, and how Black women are often left not being listened to as they advocate for their needs, especially in delivery and in pregnancy. And one thing that's really powerful about building in this coalition is that our partners and over 50 organizations work in over 20 countries. And so we really have seen, and we look at the impact stories that they're delivering on the front lines as frontline implementers for maternal newborn health projects in many different settings, in many different climate settings. A lot of them are humanitarian crisis response. Many of them are in Gaza right now, in Yemen, in Syria, delivering these cares and these needs. But it becomes, and it feels almost impossible to them. Because you think about a mom in Gaza, she's not thinking about going to her antenatal checks. She's thinking about how to feed her children. And then you have lack of access and nutrition that's affecting, right, malnutrition. It's also driving up lactation issues for pregnant and breastfeeding mothers. Like, this is all a systemic effect, and it's really, really, it's devastating when you think about it. 800 women a day die from preventable complications in pregnancy and childbirth, completely preventable. That number jumps up in places of crisis and affected settings. But oftentimes when we talk about issues in areas where we're vulnerable, we think, okay, this is a part of the world that's so far away and so disconnected from anything else that we're part of, but it really isn't. And so for me, a just transition must include safe pregnancy and safe delivery. If women cannot safely carry and deliver babies because of heat, displacement, hunger, and has made care inaccessible, then our adaptation strategies are failing, like truly, period. And that is a grave injustice. And so oftentimes in the conversations, especially at UNGA, I rarely hear people talking about the impact on moms and babies. I rarely hear people saying names of places that are undergoing crises like a genocide in Gaza. And it's really frustrating personally, and it's frustrating for us who are advocates and who have partners on the front lines delivering these programs, risking their lives day in and day out, facing these climate vulnerabilities. So for me, centering maternal health in this conversation, especially on the road to COP30, is not just a moral imperative, it's also a practical lever, because when mothers survive and thrive, their households, communities, and society overall will be more resilient and will continue to thrive.
Just to sort of zoom out and build on that in the same way, same time. We know, the basic contours of the climate crisis are those least responsible for the crisis are those most impacted by it, whether it's countries or communities. So the most vulnerable are the most impacted. We also know that those same communities are the ones with the least access to health and care. And so the climate crisis is a climate justice issue, and the health connection to climate change is also a health equity issue. And so there's this intertwining of health equity and climate justice that we really need to address and be conscious of as we work on these issues. And when we think about a just transition means supporting the achievement of health equity and climate justice, on the one hand. And as part of that, I think, and this is just sort of to segue to a little bit of a different topic, but bring it back around to healthcare workers themselves, is that what we haven't thought about, and the Belém Action Plan begins to address, is what does a just transition mean for the health sector? And what does it mean for healthcare workers? What is a just transition that is one that supports adaptation and mitigation in the health sector and the transformation of the sector? What does it mean for nurses? What does it mean for doctors? What does it mean for the people who are the engineers who run hospitals? How do they get trained and so that they can help implement strategies that bring in renewable energy and more sustainable practices? How do we make sure that our physicians and nurses on the front line don't get impacted by heat stress and are able to treat the communities in a natural disaster? There are a series of just transition questions for the health sector itself that go right into the whole question of access, equity, and climate justice.
Yeah, that's an important point. We're talking about this at a time when the United States presidential administration has sort of made it very clear that climate and even related issues like climate justice are sort of not a priority, to put it mildly. And I think we've seen a lot of policies in the U.S. that sort of aim to sort of even get at the intersection of climate, like to address both climate and intersect with climate justice, get dismantled over the course of this year. It's important to talk about sort of how this affects the work you all do and how does this affect sort of the global situation, because the U.S. is also, not in charge of everything, and there are plenty of other countries that are proceeding with their sort of transition plans and their net zero goals. So, I'd love to hear from, our panelists about sort of how does this affect the work you're doing? How are you seeing it playing out in the spaces you operate in professionally?
So I think I see 3 layers of a problem. One is data availability, access, with, for example, air pollution monitors historically having been on US embassies, those being shut down, other kind of core data that we need to know and predict the future and model and do kind of public health research. There's a real threat that that the US funding is going to shut down knowledge and understanding and prediction. So that's one thing I worry about. One is obviously funding, and it's important to say that it's not the US alone that has kind of gone down in terms of its global health funding. We've seen the UK, we've seen many, many countries turn inwards and start sort of funding less. And so there is a concern around funding. But the biggest one for me is, what is happening in terms of the policy language, the space, the commitments, are we backtracking? And that, and what is happening there? So, we see it. It's not that we don't see it. But there are champions. There are champions, at the grassroots level, and, youth are the ones that give me hope, but also different countries, countries that are coming to UNDP and saying we need support, because we see, I think for the countries where the climate impacts are undeniable and they're happening right now, and they're not impacting just a small minority of kind of, a small community, they're coming and they're saying, we're here, how do you help us, how do we plan for this? And I think different, groups and coalitions need to be strategic around what and how we support. And I think there's a lot of behind-the-scenes strategic conversations happening. So I am hopeful, noting that this moment is a difficult one. So I don't want to undermine, both the data and the funding challenges, but there is a lot of strategic collaboration and people stepping up, and really the networks, the South-South Learning, the youth networks, there seems to be a lot of momentum still. So I have a lot of optimism.
Yeah, but to your point, the financing is an important gap, and I know Isra had some kind of really interesting examples of how you guys have been able to sort of adapt and even kind of I don't want to say thrive, but certainly it sounds like you found some really interesting sort of solutions to this moment.
Yeah, definitely. Thanks, Emma, and thanks, Natalia, for those comments. One of the challenges when we were establishing Every Pregnancy that we recognized very quickly is that there's outdated funding models in this space. And you could really apply it to any sector in the nonprofit world specifically. But people depend on governments, in my opinion, too much for funding. And then we end up in crises like with USAID being shut down that truly did impact so many frontline implementers, and it's devastating. And so how do we prevent that type of cascading effect that was detrimental in the future? And so we, as Every Pregnancy, came up with an approach of a catalytic funding model where we seek catalytic funding investment from philanthropy foundations. And for us, it was the Gates Foundation that invested a few $1 million into our Ramadan campaign, which is where we then mobilize the grassroots community and the Muslim community in particular towards maternal newborn health in a way they've never been mobilized before. And this has never been communicated to them. Even the nexus of maternal health and climate has never really been communicated as a priority giving bucket for them. And we used the Ramadan campaign with a $3 million match fund for our partner organizations to go out there and fundraise with our community that's ready to give, the most philanthropic in the world, but really with the data that says that Muslim majority countries, moms in Muslim majority countries have the highest mortality rate. And that's just facts. And so we were able to equip champions and use influencers and ambassadors to take this message out there and incentivize the partner organizations, these humanitarian implementers that need that funding, to go out there and have unrestricted reserve to this $3 million catalytic funding from the foundation. We mobilized over $21 million that 1 month of Ramadan for maternal newborn health projects. And we got that from over 37,000 unique donors, and donors who from around the world, over 80 countries, engage with the campaign. That was a pilot that we decided to do, and we noticed how successful that was. But to me, it proves one thing first and foremost, is that the community is actually willing to give more. If you actually communicate to grassroots donors, you will find that a lot more of them can give. It may be $20, it may be $50, but they will give to a cause that they feel passionate about. Which drives me to the second point. The messaging is critical when you're developing these campaigns and when you're talking about these issues. Not everyone is as sophisticated or understanding the technical expertise of climate experts or maternal newborn health experts. I'm not even one of them, to be honest with you. Originally, I'm an activist. I care about social rights and social justice across the board, and human rights at the core of everything. But that being said, I can easily frame an issue to make it easily relatable and tangible and digestible to anybody for them to understand, whether that be climate or maternal health impacts. And once you're able to frame that, you're building salience. And that really leads me to the third piece. You have to not look at the crisis in which we're operating from, even from an NGO perspective, as one that is just a funding issue. It's actually a community salience issue. People are not understanding the impact of the cuts, of what it means to not have funding to the frontline implementers, and what it means that their responsibility as stakeholders to solving this crisis. Because at the end of the day, these crises are a global issue, and it really does impact all of us, whether we understand that and recognize that from our privilege perspective or we don't. So we built salience in the community. Now we're seeing maternal newborn health and climate being talked about in a community that typically doesn't prioritize it. We've found out that as a pilot, they do care about it, and we're expecting a $10 million match fund for next Ramadan, and hopefully we'll be able to raise $50 million with that from our organizations and our coalition, because when you are able to mobilize a community and then incentivize a founder, a foundation, and a funder with implementers directly implementing that work, it's a perfect model. And to be honest with you, we've seen success with it, and I would love for anybody and everybody to replicate that model, because we're not gatekeepers, but we also need to see these new blended transformative ways of financing and innovation to be able to carry this work, because we cannot depend on just one source of funding. And we've seen the effects of that this year especially.
It's a really interesting point, because I think someone said earlier, you know, what is the climate crisis if not a health crisis, right? You know, we're talking about the habitability of our planet, and yet it's sometimes, as we've discussed, the sort of health point of all this gets sort of lost in the shuffle of everything else that's being affected by this. You know, I want to talk a little bit more about this like political moment. I mean, what's the solution, like, you know, to sort of inspiring communities, continuing to carry out policy and training and, you know, raise financing for sort of continuing this work. You know, I'm curious if any of our panelists who haven't yet spoken about this might have, you know, thoughts based on their experience or what they've sort of seen around them.
Sure. I'd say two things. One is that while the government of this country has pulled back significantly, there are many other governments stepping up. So, you know, and Brazil's leadership in the context of COP30 is really important, and their vision of maintaining multilateralism through this process is really important. ATTACH, the Alliance for Transformative Action on Climate and Health that I mentioned before, has several new members this year, different national health ministries that have joined. And so the momentum continues to grow. Here's another example that's, you know, very much Climate Week related. Last year at Climate Week, during the Clinton Global Initiative, Healthcare Without Harm and the UN high-level champions announced a commitment to double the number of healthcare institutions committed to race to zero, to net zero healthcare, while protecting more than 100 million patients in the catchment of those hospitals that were committed. And we had, at that point, 63 participants in Race to Zero. We said by 2028 we would double it. This year we have 93, so we've already increased it by 50%. In the middle of everything that's happening, that's going on. And those are non-state actors. Those are subnational governments and private sector healthcare. And we're seeing a lot of that action happening in the United States as well. The U.S. Department of Health and Human Services had a climate action pledge that had, how many hospitals was it? It was like 200, a couple hundred hospitals that were part of it. There are 163 hospitals and health systems in the U.S. that have replicated that pledge together with Healthcare Without Harm and are continuing to do the work. So the momentum continues, and the momentum continues to grow despite the retrograde policies of one country.
One point to what Josh said and what you were saying. You know, I think it's really important to mobilize populations as you did, but we're not going to solve the crisis through individual donations or foundations. It has to be government money. And I'm not talking about government like donors, but government domestic resources. Governments need to say, we prioritize this. And to do that, I think there's two things. One is you need to get the public to make it a top priority because they're responsive. You know, a government is elected and therefore in places where it's elected, responsive to the public. And the other point is to show that it makes financial sense. So UNDP does a lot of investment cases of, you know, if you actually, like the return of investment of this, and, you know, solar energy, wind, you know, renewables are becoming more affordable, so it actually makes sense, but there might be an upfront cost. So I think there's a lot of work that needs to happen at the same time. The public to demand and the government to decide that, yes, we need to invest this money into rebuilding our health systems because, and this is where timelines come in. You know, the returns may come in 5 or 7 years and you're political, but I think we can't shy away from the fact that we actually need governments to prioritize this in order to get that.
And I'll just add one thing I think that I've seen have some really growing momentum and I think is really ripe for action is the ability of health systems and the healthcare workforce to be raising the alarm on the root causes of climate change and how the fossil fuel industry has been really driving misinformation and really, you know, covering up the contribution to climate change. And so I think health professionals have a real big opportunity to be able to link health harms to fossil fuel extraction. Last week, the Global Climate and Health Alliance released their Cradle to Grave report, which provided a comprehensive overview of how health is impacted by fossil fuels and really is a powerful call to action for governments to be supporting a just phase out of fossil fuels. So there's that piece, and then also how can health professionals partner with communities who are on the front lines of fossil fuel extraction in ensuring that their voices are part of that conversation and that we are looking to solutions that are not based on the old model of extraction in sacrifice zones, but actually listening to community leaders on what the solutions are in transitioning to clean energy sources.
Well said. Well, thank you so much to our panelists for being here. This was a great discussion, and you all contributed so much, so thank you so much. As you just heard here, we still have a ways to go. I thought Natalia's point about sort of the role of government remaining really important was an excellent one. So we've here kind of been talking about how the health system around the world has been responding to these new challenges like new disasters and heat waves and things like that. How the health systems have also been increasingly mobilizing to this challenge, right, over the years, and there's been so many new initiatives sort of springing up in this space. Yet there's still a tremendous amount of gaps that we have to address and think about. Including some of the new challenges that have cropped up only this year and in the last few months. So I want to hand this over to Yake to announce a new kind of initiative along these lines.
Thank you, Emma. And can we give a big round of applause to Emma as well for moderating this panel? And so, yeah, Healthy Planet Now, in addition to amplifying the stories, we want to translate these stories on climate and health into tangible actions and commitments. So we've been working very closely with GCHA on this new exciting initiative, and I could invite Kara to share a little bit more about this exciting initiative that we'd love you to be a part of.
Thank you so much. And I think as we've kind of heard throughout the session, as you know, COP30 is approaching, the world has yet to witness the bold country-level commitments that are needed to confront the escalating climate crisis. And now more than ever, we must move beyond discussions and pledges to decisive implementation of transformative climate action. So today, on behalf of the Global Climate and Health Alliance, I'm proud to stand with the Healthy Planet Now initiative in launching an open letter urging governors and ministers to place health at the center of climate policy and to raise ambition at this crucial intersection of health and climate. So as the letter is specifically calling on governments to take the following key actions. So accelerating a just transition from fossil fuels to clean, renewable energy, providing finance for local climate action that strengthens systems and builds resilience, addresses conflict of interest by limiting the influence of health-harming, high-emitting industries, and integrating health and well-being into climate policies, narratives, and targets. So today, we're inviting leaders and organizations from all sectors to endorse this letter and add their voices to the growing call for climate action that puts health first. A strong and diverse coalition of signatories will send a powerful message of united support for a healthy planet now. We already have some really amazing initial signers. So thank you to Marcele Oliveira, I don't know if you're still in the room, who signed on as the COP30 youth rep. Also have Healthcare Without Harm, the Alliance of Nurses for Healthy Environments. So I encourage you to scan the QR code, and thank you for standing with us to amplify the call for health at the heart of climate action.
Great, thank you. Shall I pass it on to for closing remarks?
Thank you. Yes, it was really a fantastic discussion, not only because we have a very clear message in regards of the impacts on humans. Putting face to climate change is one of the opportunities this year, especially as the agenda of the COP30 is bringing adaptation and resilience cross-cutting across all these pillars. My name is Marcia Toledo, and I work with the Climate Champions, very much supporting closely the COP30 team in accelerating what is the action agenda this year. And what you very beautifully reflected in the panel and the discussion earlier today is really how are we going to accelerate all the multiple initiatives, all the efforts that has been for decades being advanced. We are not doing adaptation and resilience for the past year, but adaptation and resilience is very much at the heart of people's days, life, connected to nature, mental health, access to shelter, access to food, socioeconomic opportunities, etc. And in that sense, is this action agenda this year that we are bringing government action and non-state actors together so that the multiple initiatives can have also a continuity. Perhaps maybe a way of explaining is there has been a diverse set of initiatives created since the Paris Agreement and the recognition of the non-state actors. But all those initiatives have as well showcased evidence, showcased progress, and inform policy shift, inform evolution and new research, etc. But this year, a legacy that will actually help bring this to the next level is this tactical plans to accelerate solutions that in the case of health, as you mentioned, Josh, very well, the Belém Health Action Plan is actually aiming to address the levers to better respond what are what are affecting, what is preventing to accelerating action? How are we better integrating the solutions? How are we better informing or financing? And as well, strengthen the capacity. This is all as well as accessing to the information, risk-informed, increasing the opportunity for multiple sectors to be actually coordinated and aligning on these opportunities. So I want to invite, if you are already contributing to the action agenda, bring other actors that you're working with. If you are not, very happy to identify the opportunities. We do have an activation group that is the 16, which is focused on resilient health. And in that emphasis is, of course, as well the synergies with mitigation. We cannot do one without the other. And in the case of adaptation and resilience, we do have opportunities to elevate, especially this year, as it complements a very important outcome in regards of the framework for the global goal adaptation. But we have to see the bigger picture about adaptation. Adaptation is about how these solutions are being accelerated, implemented, in this case, bringing multiple initiatives that address these barriers or these enablers. And at the same time, the clarity on tracking the progress on increasing the resilience of people. How are we going to do that, and how we harmonize this opportunity to also better explain those let's say, impacts from those solutions that are being implemented, as well as other socioeconomic opportunities that come. But a very good point came in the discussion that at the end of the day, we are not going to accelerate all these action if we're not necessarily advancing adaptation finance or better articulating them in the processes. So the session before that addressed investable NAPs gave a very good idea and opportunity to how we can better aggregate. And the story as well and the example of thinking about innovative ways can help complement, of course, public finance, but also identify how these other sources can be better aligned to the priorities that can be aligned in the case from the country level, but as well bottom up. That opportunity to bring the reality of the local up, it is as well really strongly needed, so that we are not only thinking about access to flows or diversifying flows, but also how are these actually are accessible and reaching the opportunity that needs to be delivered on the ground. And on that term, very excited to recognize the multiple diverse actors that the Resilience Hub is bringing together. This is, of course, one of the beauties of the Resilience Hub, and in this case, the collaboration as the home of the Race to Resilience to really bring and bridge among different actors, different stakeholders, and we want to keep that spirit. And so very much as well looking forward on the road to Belém and bringing the results and the opportunities that have been discussed here in New York. And with that, happy to bring Jorge for the closure.
Well, thank you, Marcia, and you said it all. See you in Belém. Thanks for coming, thanks for staying, and paying attention, and glad to have you here. So see you soon. We'll be there, 5th year in a row. Not easy, but we're being resilient and trying to push forward. Thank you.